What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're going to cover the most painful things I've seen in the ER as Xray Tech. So to give you context, I work night shift and I work 7 on 7 off, and I dabble in day shift because I work a lot of overtime. So some of the top things I would say that would be the most painful is to see someone die and you were there performing the exam and they die, and like a part of you feels bad because you're like, dang, if I would have done this, or if I would have done, like, it kind of gets to you, especially if a baby dies. The whole ER kind of just like it's a mood. Like it's rough, especially the nurses who, like, especially if that was like their patient, and then Lord knows if it was like a family member of someone, or they kind of knew, like it gets kind of devastating and stuff like that. And then another one would be like if a patient's like hurt real bad, like I'm talking about like they crashed and like you see their bones sticking out and like they're like crying even with drugs and stuff. It kind of like you feel for them, like you feel really bad. Like the worst one I've had was someone like crash and like half of their head, like you could see their skull and like their brain and stuff, and like you just like it will be some serious gruesome stuff that will happen sometimes, and you like it'll change you. You have to be sometimes a little bit different. Sometimes you have to like go in there and kind of just like try to do the best you can. Because there's been times more of students that will come in there and they'll see some of the true traumas, and that's kind of like where you show your skills as far as getting the job done in the more like severe cases. Sometimes there's times where like techs freeze, or like the students freeze, and like I've never had that happen, but like it's kind of like where the veteran techs kind of should like step in and like, you know, take over and get the job done, you know. But like there's times where also like when you have people who come in for like aggression and like you feel threatened and you feel not safe because they have like a knife or they somehow slipped by with a weapon, like you feel for your life even though you're just trying to help them. Sometimes with drugs and stuff, people are aggressive. So sometimes you see like pretty severe stuff in the emergency room, which I'll cover another video in depth of all that. But those are some of like the common things that I would say are like the more tragic stuff. Or like occasionally we'll have like in our city like the building burns and people will come in. That one's bad too. Like the burning of skin, people come in all burnt and like red and like they're in pain, and like it don't matter how much drugs, how much stuff like that. Like it's bad. It's just constant. Yes, been your boy Miguel. See you on the next one.